Hey, Mo,
Hey, Ricky.
the doctor is in.
The doctor is definitely in, and we're in tonight with an amazing topic that I think we're hearing more and more about. As we've entered this information age, I think COVID has really done a number on all of us and our ability to reach each other virtually, which is great, right? Right. I can do telehealth consults with patients across the country now, but everybody's worried about their data. They're worried about what happens to my stuff. And this is a great conversation to have today.
And first, I got to start by saying I have Valencia here. She lives in Daytona, but she showed up at my front door today. So she's here today. And we actually have been hanging out at the Gilead office. So there's our Gilead friend.
Incredible. Hi. Thank you for all that you do in October and beyond, guys, because it's not just Breast Cancer Action Month, not just Touchtober, but folks are living this every day 365. And so we have to make sure that we highlight, we honor, and we keep doing the work. So thank you.
And Trodelvy is our miracle drug for triple negative right now. So they are working really hard. And they're actually sponsoring the congressional softball game tonight. So we sent Cynthia out there, sensational Cynthia, to throw the first pitch for us. And they're dedicating the funds to YSC in honor of triple negative breast cancer. So it's a really cool thing they're doing. But anyways, that's where we are. But we have two fabulous guests. So I'm going to let them introduce themselves. And one of them I love very much. I'll tell you that story in a minute. That's why I don't love you, Andrea, but go ahead, Andrea.
I love you too, Ricky. Hi, it's nice to meet everybody. My name is Andrea Downing, and I am the co-founder of a nonprofit called The Light Collective. And along with Valencia, who is on our board and also a founding member, we're really excited to talk about this topic today. So it's Breast Cancer Awareness Month, and it's also Cybersecurity Awareness Month. And I happen to be a white hat hacker and privacy advocate. And my foray into this came from my story with the BRCA gene and my experience as a previvor with BRCA1 mutation. So I have a little bit of background here. I started my career in technology. I have this geeky passion for data sharing, but as a cancer advocate, I really, come from our community's perspectives, specifically through the Light Collective. Our mission is to kind of figure out ways that we can foster healthy human connections on the internet. And that starts with our peer support groups, our lifelines, many of them that exist on social media. The question we have today that we're exploring is your health information safe? And there's a lot to talk about here when it comes to law, when it comes to how we think about ourselves as advocates in the tech platforms we reside on. So that's me.
Great. So when Valencia and Andrea brought this topic to me, I said, oh my goodness, we need a lawyer. And we need somebody who understands cyber law. And so then I remembered that I have one of those in my family. And so this is my badass, brilliant, brainiac, amazing cousin, Jillian Simons. Georgetown undergrad, Harvard Law, just amazing woman. And she's done, I'll let her speak for herself, but I'm so proud of her. And she's my baby cousin, and she's brilliant. So go, Jilly.
Well, thank you. I don't know what I can say after that. But Ricky is such an inspiration to me ever since I was a little girl. And so I love her dearly. And, I'm always watching, seeing what she's doing and try to emulate her in some way. So it's a huge compliment. But yes, I am a corporate attorney, but what that means is that I advise companies in relation to privacy, cybersecurity, data protection, all of the buzzwords that you've been hearing lately. And before I went to law school, I spent 8 years in the Navy on active duty, where I was a cybersecurity analyst. And then I spent a little bit of time as a cyber intelligence analyst, which is tracking hackers, threat actors, the tools that they use to grab people's information and put it on the dark web. And so that's just a little bit about what I do currently. And just happy to be here. So I'll turn it back over to you, Ricky.
This is exciting.
Great. Told you
Can I
she's a
ask
good.
Can I ask a question? And I've been dying to find somebody to ask this to, and I certainly could look it up, but what is the dark web?
Well, it is, so we have most people's interfacing with the internet would be through a search engine like Google or Yahoo or Bing. But there are many ways to be connected to other people, which in the simplest of terms, that's what the internet is. It's a connection among many different laptops, computers, mobile devices, and nodes is what we like to call them. And so these are places where you can't just go into Google and search for these sites. You would need to know either an IP address or some very specific other types of, without getting too technical, we have different ways that you can navigate to these actual sites where people are. There's, depending on the site, there's an extreme vetting process. They don't just want anyone creating an account. But in a nutshell, that's all it is.
And who regulates that? And I guess the other question, the bigger question, who regulates the internet? Or because that's like the World Wide Web, right?
Yes.
Yeah. So one of the things to keep in mind here is that there's one core body, if you think about enforcement or an agency that oversees consumer protection, and that's the FTC. So the FTC protects consumer privacy when it comes to health data breaches or anything that relates to unauthorized use of your data. However, there's a lot of conversation on the Hill right now about what more protections we need. Do we even need another agency? When it comes to cybersecurity, there's also, and I'll hand it over to Jillian, there's, CISA, which like kind of relates to Homeland Security and others. But Jillian's the expert on that.
Well, I do want to take it back just a quick moment and just say generally where you are geographically located determines who is governing or regulating the internet, so to speak, but there isn't really a regulation to it. And that was the intention of the internet. And so that's getting into, quite a political issue these days. But yes, we do have the FTC here. We also have the Office of Civil Rights, which is in the Department of Health and Human Services. And I'm sure most of our participants here today have heard of HIPAA. And so those are the ones who are going to enforce any HIPAA violations, which are specific to those who are healthcare providers. And that can extend to those providing telehealth services. But it will not extend to like your social media platforms. And that's where the FTC comes in to try to pick up that gray space where they're not healthcare providers, but healthcare and medical information is possibly being exchanged.
I think it's also a common perception. Like a lot of people think, oh, my health data, it's health information, so it's protected. That's really like a myth. A lot of advocates, including me, when I started out 10 years ago posting on social media, I didn't realize that health information on social media isn't protected by HIPAA at all. So one thing to keep in mind is there's one law at the FTC that kind of protects health information that they have the authority to enforce. And that law is the health breach notification rule. Now, you can go to the FTC and bring about a complaint, a consumer complaint. But interesting fact, that law has never once been enforced since its creation in 2009. So I think we have a lot of right now debate within the FTC and other places, like how does that rule get enforced? How should it get enforced? And they just kind of issued a decision in September around like how they're thinking about health apps, mobile health apps, because those, if they're not connected to a HIPAA covered entity, aren't covered either. Like your Fitbit or a fitness tracker or an app for cancer, if it's not connected to a covered entity, is protected by the FTC as well.
Wow.
So
And
Andrea,
I forgot to.
oh, no.
Oh,
Well,
sorry.
No, it's
Who are
okay.
you? Who are you? Who are you?
Everybody knows me. I'm Valencia Robinson, and we are breasties, triple negative breasties. But Andrea, I want to ask you a question. So I was diagnosed a long time ago in 2006. But for people who are getting diagnosed today, they are seeking support, and they're going on Facebook and they're looking for groups, triple negative breast cancer groups. They're looking for double mastectomy groups because maybe they're having to have that done. So I want you to tell us a bit about when you join a group, what actually happens? What do patients need to know about joining these groups on social media?
And you're giving away a lot of information. Like I had chemo today. It was,
Great
you know,
questions.
adriamycin. I'm giving you my treatment plan. I had my mastectomy yesterday. I feel bad. Like we're sharing, bearing our souls in these groups.
So I think this is really key, and I want to empathize with everybody because we're live streaming this on Facebook, and many people
Right.
coming from our community are there because of support groups.
Yep.
Valencia and I got together because I am part of a support group called the BRCA Sisterhood, and it's a lifeline, right? And you're right, there's deeply intimate stuff that has been shared about our community. I'm going to tell you a little bit of a scary story. It's almost Halloween, so brace yourselves. Should I go into it, Valencia?
Yes, definitely.
Okay, all right. So all of this is public, by the way. In 2018, I started, this was like my fall down the rabbit hole of what we call being an accidental hacker that has created this path for me. In 2018, I started doing research about how Facebook groups attached a real name to a clinical fact about you from outside of the group. You didn't even have to be inside the group in order to access that information. So from the user interface, like from like the public user interface, you could go in and actually see the real names of who was a member of the group.
So talk to me like I'm a 5-year-old.
Okay, sorry. Basically, I found a way to find the real names of people who were members of a group. And then I went into the back end. There's all these developer tools that are working as designed on Facebook. And I looked at different ways that you could take your real name, the health information about you, and attach it to things like your email address, your phone number, your physical location. And that didn't even require consent from the members of the group or the admins of the group. Now,
Wow.
the good news is that I have good news here, which is that happened in 2018. And the biggest part of that, which was the wide gap in closed groups showing those real names, has been closed. So that's good. That's good news. The bad news is we submitted this to Facebook, and then when Facebook said this isn't a problem, it's working by design, we went to the FTC, we submitted a complaint. All of that was public, and then it kind of went quiet after the pandemic started. So we're still, I think now that this dialogue is now starting again on the Hill, and we're emerging still almost 2 years into this pandemic, like now is starting to be the time that people are thinking about digital rights, what is happening next. And that's why we're seeing all these new revelations in what are being called the Facebook papers. So we'll see, time will tell. I don't want to scare everyone because I know there aren't a lot of options that our groups have because it's so pervasive. Right. It's kind of a monopoly. And that is sort of an FTC issue. We'll see if they decide to enforce antitrust law or something, to break up Facebook. We don't know what will happen.
Yeah,
Something else I can say that I think that we should keep in mind as well is that you have identifiers attached to your accounts on these different social media platforms. I don't want to just pick on Facebook, but for all of these, you have different tags, different topics, things that you've looked at, things that you've searched, things that people have sent to you, and those become associated with your identity on that platform. And that information can get sold to various companies that have entered into a contract with these social media platforms, and they target you for advertisements. Sometimes they're targeting you for advertisements on those platforms, and sometimes it's through other ways, right? So when you are searching something on, let's say, Google or Yahoo or Bing, and you start seeing advertisements for things,
Right.
it's because of those tags that they've associated with your identifiers. And so to Andrea's point, unfortunately, there's nothing you can do, because every time you log in and click OK, you've provided consent in order for these things to happen to you and to your account. And unfortunately, the companies who are contracting with these social media platforms, they are also unable to negotiate these terms. And so the entities that have the power are your social media platforms, and they control what the companies can and cannot do, and they control what us as users can and cannot do.
Are you referring to the cookies when you click on something, a website, and it says you have to accept the cookies basically and acknowledge that they can do whatever they want with your information as long as you consent to it?
So that is one part of it. There's this new-ish tool called Pixels. And sometimes when you're on a website and each time you click around on the website, it sends a different message back to the social media platform or to the company itself whose site that you're on. There's also web beacons. So there are a variety of tools, but I wasn't even directly referring to those. This is simply what's associated to your account on that platform. And companies pay a lot of money in order to find people that they think may be interested in their services and products. And so the groups that you're a part of, the things that you're searching for, the types of posts that you click on, the things that you comment on, the things that you like, all of that is helping to build out your advertising profile on that platform.
Now, that's such a beautiful explanation. I want to add to, there is one thing that you can do if you've been on a support group for a long time. And this is kind of why we call it the Light Collective for our nonprofit, and the cause is Be Like Light. Our goal is to shine a light in these black boxes. So my call to action here for anybody who's listening and is on Facebook, like, oh my gosh, what do I do? You might not be able to move off right now, but you can download a full archive of your Facebook information. And
Wow.
we have some videos on that. If you want to go on Twitter, if you can tell, I prefer Twitter because everything is public on Twitter and you kind of know what you're posting, even though they target ads. We have our Be Like Light hashtag and account. We have a video of how to download your Facebook information. You basically go into your settings, go to your Facebook information, and you download a big archive of that. I would recommend, if you decide if you ever want to delete Facebook, do that first, because there's some key information in there for health groups.
And
go ahead.
And you need to tell them that you really need to do this from a laptop. Don't do it from your cell phone. If you're searching on Facebook from your phone, you really need to do it from a computer. I started Facebook 2001. So when I downloaded my archive, it took hours. I just left my computer right there.
Yeah.
And it was a long process of downloading everything. And it's tracking your off Facebook activities also. Tell them about it.
So
what do you do with that information too? What does one do with that transcript?
Well, let me tell you what we found out. Valencia and I, I really would love anybody on here to try this and see what they find out. And you can reach out to me on Twitter. My Twitter handle is Brave Bosom, but if you want to message me, or we can, however you want to find me. If you download your archive and you go to off Facebook tracking, what Jillian is talking about is pixels, right? So if you go in there and you find health sites that are tracking you off Facebook, see if their privacy policies tell you whether or not they're tracking you. Because if they didn't tell you that, they might be breaking the law.
Well, they are.
Well, okay, I'm gonna defer to the lawyer on that, but this is the question. Like, they are breaking the law, and if we find that, so we found a really interesting list when we downloaded, Jillian and I. I'm sorry, Valencia and I, our archives, and we're like, okay, what do we do with this? So one thing I want to make key here, or make really clear here, is that downloading your information just to see what's tracked off of Facebook, that's like shedding light on something that you didn't know before about how you've been tracked. Knowledge is power, right? And the first step, even if you're thinking about like what to do, is knowing, okay, am I okay with this? Am I okay if somebody has tracked me off Facebook? We're trying to work to get organized and help patient groups on social media figure out what to do if they found anybody who has broken the law. And we found a few, and we're just trying to figure out what to do with it.
Well, you can file a complaint with the FTC.
I'm going to talk to you afterwards, Jillian, to see if
With your data, you can file with that data. You can file a report with the FTC.
Yes. There's some things that I can't say, but what I will say is that this health breach notification rule is something that they are looking to enforce. They do have a new chair on the commission. They do have new commissioners coming in. And so it'll be interesting to see what the new approach will be. Part of what's being discussed in their recent policy statement and other guidance that they've given out is that they don't want companies to be able to sell or share or otherwise disclose or use any health or medical or insurance information at all. So, we'll see what direction the regulators start to move towards. But as a general rule of thumb, I know privacy policies sound daunting, and it's a little thing at the bottom of a website that you may or may not ever have noticed. It'll say privacy policy or privacy notice, but they have to be easy to read to some extent. So if you ever click on it, it'll tell you whether or not they're selling your information to other companies.
Wow. Chances are they are too, right?
And what if they don't have like an opt-out button? How would you?
How can you stop it?
Yeah, so unfortunately, there's only a handful of states that even have a consumer privacy law, right? And so like California is leading the way. It's one of the most robust ones. You have Virginia, Nevada, and so there's only a handful of states. Colorado, sorry, I left that one out. So for everyone else, you don't necessarily have the ability to opt out. The answer would be, unfortunately, you just have to stop using that website or that platform or that service.
So Jillian, how long will it be before there's a national policy? If states are taking their time to enact legislation and policy, how long? I mean, why isn't it a national federal law or mandate or whatever?
Well, lots of advocates, sure, Andrea included, have been working on this for decades, right? Since the internet was really online and made available to most people. So your guess is as good as mine on that one.
I would actually say that it's actually up to us as advocates and leaders to start making some noise about this. And my one call to action here for this community, and just thank you for inviting me today to talk to everybody, because this is something I'm really passionate about. But as a nerd, it's sometimes really hard for me to get the message out. I have been working on this nonstop since I found what I found in 2018. And I knew something was really wrong and off. And I thought that at the time, oh my gosh, this is going to be over in 6 months. here we are after a pandemic. You know, if you had told me the things that would have happened since then, I would have, you know, said you were crazy. And here we are now, and in this very unprecedented situation, what I'm asking is leaders and advocates of not only the breast cancer community, but other health communities to kind of join together. And we as advocates really need to start driving this dialogue. Because there were Senate hearings today, but all they're talking about is teens and Instagram, not this. And if
Right.
for as loud as I yell as one person, you know, this will only happen faster if we get effective advocacy, allies to help us, clinicians and experts that can guide the way and make sure that we get laws in place. And in the meantime, the laws that are being broken, I think there needs to be enforcement of the rules that we already have. Unfortunately, that $5 billion settlement that happened in 2019 had no protections for health information, even though we did an FTC complaint. So hopefully the leadership, now that we have a new set of FTC commissioners, will change that. I am looking out, I'm thinking more optimistically about this, but it really depends on us.
So you guys, like, you know, I'm a Facebook geek. I'm a Twitter geek. I love social media. My daughter's like, you know, like, Mom, I can't believe you posted that. And so, but I post every day, and I love, and you know, we wouldn't have been able to have this platform without Facebook. We feel like during the pandemic, could you imagine not having social media for the last 2 years, right? We would have been gone crazy because it's connecting us. So there's a lot of benefits to this platform and to these platforms. On the other hand, we don't want to take advantage of people. So are there things that we shouldn't be talking about? Are there things that we should have to that we need to be doing to protect ourselves? Because I mean, breast cancer patients need other breast cancer patients. We need these support groups. It is like a lifeline person. You said that earlier, Andrea, that I know that my breasties are really dependent on turning on their computer in the morning to find their friends and say, guess what? I rang the bell today. Or guess what? My chemo sucks. I don't feel well today. Can you pray for me? And, or, you know, or guess what? I need someone to help me with something. Who can babysit for my kid today? So we have these very intimate relationships with our social media friends. And I don't want that to go away. So how do we protect ourselves? What do we need to do to, you know, to be safe?
So there are a couple of simple things that you can do right now. And this is the way I think of Facebook groups now, as opposed to when I discovered things in 2018. The first thing is assume the group, even though it has very limited protections, assume tomorrow that information would be public. That's why I prefer Twitter, because Twitter does not require real names as a policy, as opposed to Facebook.
Right.
Facebook requires your real name and then adds all these additional facts about you. And that's by design. It's a marketing lead platform, which arguably Twitter is too. But at least on Twitter, it's very clear the representations they're making to everybody. So in a closed support group, I would say sometimes when you're going through trauma and you need social support, because that's a basic human right. I have been there. You're weighing the risk and benefit of what you should be posting in the group. This is why I think we really need to think differently about privacy, because we need safe spaces. Those are lifelines for us. They're sacred spaces. And our support groups should have the freedom to be vulnerable with each other without looking at 50 pages of privacy policy. But really, you got to think about it that way as the one thing you can do. Assume if outed tomorrow, you know, some people in many groups kind of post intimate photos, very intimate photos through their healing process. Really think carefully before you do that in a support group, especially if it's a larger group of, say, 10,000 members. Be super careful about the fact that your real name is associated with your breast cancer status. If you don't want your employer knowing that, consider alternatives like there's a really good open source alternative called Signal. Signal is starting to get a little bit better when it comes to forming groups. And as Jillian may attest to or not, I don't know what you think about Signal, but it has encryption. Encryption is a way to keep data. I'm trying to explain it like more private when do you want to explain encryption, Jillian?
I think I would probably be even more technical. That goes back
Okay.
to my Navy days. But yes, what it's designed to do is to keep the data that you're sending from one point to another safe. And so that anyone that intercepts the data along the way should not be able to read it. They shouldn't be able to access it. So it's supposed to help maintain the confidentiality as well as the integrity of the data you're sending from one point to another. I think that was probably more technical than what
No,
you
I
were going to say.
well, I
That's
thought it was
actually really good. Can I
perfect.
jump in and ask a question though? So
Sure.
for patients who are now, let's say, seeking or they're blogging, right? I've seen a number of patients who are blogging about their experiences and they're sharing their stories, not necessarily on social media, but on other websites. Are these things that they should look for, or if they're participating in clinical trials online, is encryption part of if there were a checklist of things that someone could look for to try to be as safe as possible, would encryption be on that list of things that they should be looking to see somewhere on a website?
Yes, I mean, usually it's signaled usually by an HTTPS as part of the URL that usually lets you know that it's secure. I mean,
Okay.
that's just general good cyber hygiene, as
I
we
thought
like
they
to
all
say.
had that. I thought everything had
Mm-mm.
HTTPS.
Me too.
Yeah.
Yeah.
No,
Oh, wow.
not all platforms. You know, obviously it's better if you can use something that requires at a minimum a password to have access to it. But, you know, certainly some blogs and other websites, the intent is to be public. In addition, I mean, just general cyber hygiene, you should want to make sure that your antivirus and things like that are up to date. And it's helpful when you're using these platforms, if you're very privacy conscious, to enable the most strict settings that they provide for. And if you have an Apple iPhone, the latest update in 15 allows even more restrictions, which is why some of these social media and advertising platforms are pretty angry about the new Apple security features. So that's something else that you can do. One other thing I would say is if you are using social media on a laptop or your computer, log out of it before you navigate to another website. And I know that can be quite cumbersome, but at least that pixel isn't following you around.
Wow. And I never turned Facebook off on my computer. It's all on.
Well, then they know a lot about you.
Your bank account information. You're gonna wake up one morning and all your money is gonna be gone.
I don't have much to go. So.
Well, I have a few other tips specifically for Facebook. I am in a lot of the communities, especially with admins, seeing we need to start practicing good cyber hygiene around passwords. If you're using a password that you've had for 10 years and it sounds like, you know, pink ribbon 123, you're probably going to need to change to a stronger password. So there's a really great resource if you Google surveillance self-defense by Electronic Frontier Foundation. It's a free and open resource on how to create strong passwords, good browsers. Not all web browsers are created equal. Like, you know, if you're using Brave browser as opposed to Google Chrome is kind of designed to gather and suck up a lot more information about you. That's why I use Brave browser. So there are some things you can do. Another thing you might consider, and I'm going to tentatively recommend this. This does break Facebook's policy, but you can not use your real name and make up a pseudonym that is a first and last name. I've seen a lot of people in our groups, especially new people, do that. However, it's not a silver bullet. There are a lot of ways to re-identify people based on their physical location or other things. which lends to the underlying theme. We need legislation and we need advocates in our communities, especially on social media, to really start making a big push to advocate for better privacy legislation.
Yeah, it reminds me of, back in the day, back in our parents' day, Ricky's mom, my mom, Mo's mom, Jillian's mom, we can all relate to what I'm about to say. Black people had to sit in the back of the bus. Black people had different water fountains. Black people had different doors they had to enter. And we had to get civil rights legislation to break the barriers. It's almost the same here. And this is even when I think of my children, my 4 children who are on Instagram and who don't know, they're so naive when it comes to this, the sexual predators. And we're just talking about our little breast cancer, but there's so many more major issues that are killing people. People are actually dying as a result of things that are happening on social media. It's really scary that we don't have laws to protect individuals, and it just makes no sense.
A lot of TikTok challenges and other things that are really, making young people do some crazy things also. So I think, regulating that. I would ask Andrew, what is that server again that you mentioned? Well, the one in the website for the passwords, but 2, the other browser that you mentioned?
Sure. So the browser I mentioned was called Brave browser. So I recommend installing that browser. That has, it blocks trackers and some of these pixels, and at least shows you what's being tracked. So that's one. And then the resource I recommended was Surveillance Self-Defense. And that's from the Electronic Frontier Foundation. If you go to EFF.org and just search for Surveillance Self-Defense. Finally, we do have resources on the Light Collective website. So if you go to lightcollective.org, we talk about the needs for better content moderation, the needs for digital rights and governance, and what that means for a peer support group. So we have some resources there as well as on cyber hygiene, but we're working to improve those because we're brand new nonprofit and budget. But yes,
I
want
like
to go back to
just 2 quick points on that. One, so for content moderation, there is this thing called Section 230 of the Communications Act, and people may or may not have heard of it. I'd say more so before the pandemic, it was getting a lot of traction, but that is a lot of proposed bills to amend that to discuss content moderation. Who should be responsible for what things that happen on what platforms, what security should be built in. So that we may see legislation for before we see a digital Bill of Rights. And then just one other point, Ricky, when you asked, are there things that we should and shouldn't say? Just as a general, again, good rule of thumb, I would be careful about what's being said in these groups because there are predators. And they do try to gain access through false narratives into groups because they know they're finding people perhaps at a more vulnerable state. And because they're feeling vulnerable and a sense of connectedness within their groups, they're willing to share a lot of personal information. And someone can take that information and they can call into customer service at your bank or a life insurance policy company. And start making withdrawals and transfers because now they know at least, the city you live in. Maybe they know your mother's name because it came up in conversation. That maybe they know your birth date. Maybe they know other things about you that can let them bypass those basic security questions. So I'd also be careful about what's being shared in the groups, particularly when they're very large groups and you don't know who is in there.
People shouldn't assume that because a Facebook group is private, that anything in that group is protected.
Right.
Assume that it's like broadcasting it on Twitter.
Right,
And
right.
really think twice, especially with intimate photos or something you wouldn't want your employer or a health care provider to know about you.
Well, so even though it's private and you don't have access, there's ways for people to track your number. So like right now, I may not be in a Facebook group, but some like Valencia is in a group that I'm not in. So can I get access to her information in that group if I'm not in it?
So this goes back to the scary story from 2018. Back in 2018, I could do a lot of things from outside of the group that I cannot do today, thanks to a lot of the work we've done. We met with the FTC, we met with Facebook's team, and they did change things, but they didn't do enough.
Mhm.
And so there's that. I would go also back to what Valencia is talking about with civil rights. Like in the early days, I was like, this is all so far-fetched. Like, what are we talking about? It's just social media. Like, it's just,
It's supposed to be
why-
fun.
why would we think about our rights? Like, are you kidding? Are you kidding me? And now I understand. And so the reason why it's a civil rights issue is this is harming people in real ways that I've seen over the last 3 years. I've had the unfortunate task of, in doing this research, I think I shared this story of the group of sexual assault survivors that was viciously doxxed, hacked, extorted. One of the group members took to Twitter. That's how I met her. And people started following these women offline. The group was quietly deleted. The same thing happened to a support group, a grief support group of, I think, 150,000 members. And there was just no help or recourse for the admins who got taken over and the groups who were terrorized. Now, that I would say is a worst case scenario. But
Wow.
we need to prepare people and know that as Jillian said, there are predators out there. There are really bad people out there. And, this is why it's our civil rights, because these support groups are human need for connection, and especially for the cancer community is so vital. So I consider social support and seeking knowledge as like a human right,
Mhm.
especially when you're going through trauma. We, no matter what platform we go to should have the freedom to share and be vulnerable without worrying about what predators are out there or who's going to use that information or sell it.
Especially if
And-
we're in a private group where we signed up and we had to go through a screening process to get into it. All of these groups say, what disease do you have? When were you diagnosed? What chemo are you on? So you have to go through this exercise of answering their questions before you can even get accepted into the group. But then I guess anyone could make it up. I mean, it's not that hard, right? If you know anything about breast cancer.
Now, what about people who are doing things like genetic testing, right? So if you go through a company like a 23andMe or something, or even if you use a company like a Myriad or an Ambry or an Invitae, and they store things in ClinVar, can you give a little bit of information about what happens to people's genetic information? Should they do commercial testing, all the direct consumer? Because we've been talking a lot about hereditary cancer testing in our groups and the need for knowing your family history and knowing your history. What happens if you get that kit and you do that testing?
Great question. So this is the world I live in, right? Because I am a BRCA community advocate, and I've navigated a lot of decisions around this. So the first thing to keep in mind is that the consumer direct to consumer genetic testing is very different from clinical genetic testing. So I'm going to separate all the privacy stuff out and just talk about that for a second. If anybody out there is wondering whether they might have a BRCA mutation, the first step there is I would go see a genetic counselor. Talk to your
Yeah.
doctor, talk about your risk factors, because there are certain things that you can do with your doctor to figure out if you are a good candidate for testing. 23andMe got into a lot of trouble a few years ago because they were making representations about their test for BRCA based on only 3 genetic mutations, when in fact, there are thousands of mutations of BRCA1 and 2 alone. So people were taking a test and they were getting, oh, you have a low, that's a normal test result, not knowing that they were only testing for 3 out of thousands of mutations. Here, this gets into a lot of other stuff that I'm passionate about data sharing and genetics. And that's actually where I started my role in advocacy. Back in 2013, there was a case about whether human genes could be patented. And that went to the Supreme Court. And part of history, human genes cannot be patented. That was a 9-0 decision between the company that did my diagnostic testing and Association of Molecular Pathology. So I kind of went around to say, like, first, for diagnostic testing companies, they're not all created equal. Some have different variant data sets. And so that's why it's really important to see a genetic counselor. I'd also say, and this is from experience in my community and my family's, my own family, if you got testing like 10 years ago, the data that we have about our genetic risk of cancer is changing.
Get it again. Yep. I just had a bigger panel than I had 10 years ago. And I still don't have mutations, but it really has changed significantly. A
Same.
lot more genes. Yeah. Get it again.
Yep. I got tested for 1 and 2, and then now there are panels of 40, 60, 80
Yeah.
genes. So there's so much more information.
Yep. Get it again. Get it
Now-
again.
Now that puts us, the BRCA community, in a very difficult position because we are a community sharing an identity around BRCA, right? And so what I found basically associated a genetic fact to our group from outside of the group, and that was kind of leaked along with all the other things in other patient support groups that were open before 2018. Still no
Wow.
resolution to that. So I don't have a good answer for you other than advocacy and civil rights.
If
I'm
I could, I'll say a
sad.
few things on like the privacy aspect of your question. I think most of us are probably familiar with Henrietta Lacks,
Yeah.
and her cells have been used for decades upon decades upon decades. And so a lot of us do not read what we're signing. And if we're presented with something on the internet or on our app, we just click yes, 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 okay, 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 because we're in a rush to get to what we're actually there for. In some instances, 23andMe, at least at one point, it did allow you to opt out of certain things that it could do with your DNA that you're providing, the sample that you're providing. And most of these commercial companies should. But again, you have to be very careful about what you're clicking yes and okay to. And that's whether you're going through a commercial entity, whether you're going to a provider's office, a laboratory, anywhere. So you should be cautious of that. One thing I will say about the rights aspect is that, in California, they have given people rights, but only to residents of California. So you can, for example, request to have anything that they have on you be deleted. There's a caveat to that. They can't actually delete everything that they have about you because these companies have to put you, in a database to say, don't ever store anything about Jillian Simons again. Well, they have to have Jillian Simons and some information about me. So these rights that we're seeing rolling out at the state level, they're not exactly as they appear. And unlike in Europe, where there are data transfer agreements. So if a company wants to share your information, your DNA across country borders, there has to be an agreement in place that specifically sets out the security measures and the privacy measures that they're going to take and be responsible for. In the United States, we do not require companies to have any such agreement if they want to move your data outside of the United States. So from the United States, we can send information anywhere. There are no restrictions on that. And one other thing that I'll point out is that in none of the state laws and in none of the regulatory guidance from like the FTC or OCR, is there a right to be forgotten. So once something is out there, it is out there. You don't have the right to be forgotten.
Even when you're deceased, you're still not forgotten.
There's a lot of dead people on Facebook. Right?
Yeah.
A lot of dead people on Facebook. Gosh, Jilly, you know, it's almost like how we tell our kids, make sure you do the right thing on social media because you're, you know, an employer's going to look at it before you're not going to get the job. But this is pretty scary. It's making me pretty sad.
Yeah, this is the hard part. You know, we're dealing with communities that are already scared, that are already sad, and these support groups are lifelines, right? And so
Yeah.
what I want to say is, you know, I feel I'm in exactly the same position with the support groups in the hereditary cancer community. And, you know, I think we have an opportunity to make some pretty significant changes if we start banding together.
Mhm.
And the question is, what should our rights be? And, you know, if we're getting in front of like Capitol Hill or, you know, organizing something, you know, we're saying, what do we want? When do we want it? And
When do we want it now? Right.
right. So, you know, this goes back to rights in a physical space are very, very different from digital rights.
Yeah.
Because when you're dealing with a physical space or physical selves, there are different harms than what your digital self might experience. And, you know, there's also how information can be copied multiple times, infinitely. We've got to start thinking about how our digital selves need to be cared for in similar ways that we care for our physical selves. Going back to that idea of hygiene, you know, we don't know, or we have this illusion that some of these choices or many of these choices about privacy are our own. And what's not being told to us is like a lot of the tools and platforms we are on are designing to make those choices deceptive. And that isn't about choice when you really think about it. You know, it's making our choices an illusion. So when it comes to our rights, how do we counter that? How do we stop shifting risk to individuals who are going through trauma, who have no idea, nor should they, what a 50-page privacy policy should be? And we should go to a place where we're actually protected and where we have laws that are enforced. Enforceable rights look like something very different than the models of informed consent that we have today. You know, we got to stop getting away from this, okay, check a box, consent, there you go. We've done our job.
Yeah.
We've got to do something like we've really got to think about governance as, this is why I go back to no aggregation without representation. The uses of our data as a community are very different than the uses of our data as individuals. And as we practice governance, we need leaders who are stewards and who are protecting data with our interests first, instead of just shareholder interests of a tech platform.
And as a point of reference, because Jillian mentioned Henrietta Lacks, Black data is worth millions and billions of dollars.
Come on.
Don't even know how much our data is worth. Millions. And as homework assignment, I'm a teacher. You guys have to watch Coded Bias.
Yes.
Coded Bias
On Netflix.
on Netflix and The Social Dilemma. Can you
Social
see?
Dilemma.
You put on the
The
blackboard.
Social Dilemma, Coded Bias. Can you see that?
Two
Mhm.
really
really,
good.
really give you more insight. Jillian and Andrea have done an excellent job, but this is something you need to watch with your children, your entire families.
Yeah.
We need to be educated, and these are great, great resources to continue this conversation with our families. When you go home for Thanksgiving, sit down and watch these movies with your people.
Let's
That's a great
teach a younger generation too.
Yes.
We need to teach a younger generation digital literacy so that when they're getting on these new platforms like Snapchat or TikTok, they are better equipped. You know, time is on their side, and they're very quick to adopt these
Right.
things.
Right, they pick it up.
Yeah. So
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 how
for
is
the
our
person-
banking information, I'm sorry, how is our banking information protected? Like it's like, if we're like, when we sign all these documents online and bank online, that's protected, right? Shelley?
I would say define protected, but I think that's a bit too lawyerly. Yes, protected. I mean, you have banks that are FDIC insured. And so if they suffer a loss, then you will have your money returned to you. And so part of when we're talking about digital rights, we're going to have to ascribe an economic value to each individual right in order for there to be traction. Because if you can't measure the harm, then they don't know how to say what's a right, what is inalienable or not. What do you deserve to have? What is a need and a requirement in society versus just something that's nice to have? But getting back to your specific question, yes, our banking information usually is, they have not only encryption, they may use hashed algorithms, they have layers, multi-factor authentication, a PIN, a thumbprint, lots and lots and lots of layers, which these platforms, whether they're blogging platforms, social media platforms,
Don't
they
have.
don't have that.
Yep, got it. Got it. Okay, you explained it to me. Okay, yep.
So for the person who's watching, who is feeling somewhat either violated and or outraged and or empowered to do something, what's a thing that they can do? Where do they start?
great question. So I want to come back to we're looking for people to join us at the Light Collective.
So I'm
And-
gonna put it in, I'm gonna put in the comments, Andrea. What do you mean to put? The Light Collective, lightcollective.org?
lightcollective.org. I know a lot of people in the community here know Valencia, as you know, so you can reach out to Valencia on Facebook. You can reach out to us, and we're starting a project this month, in fact, with Robert Wood Johnson Foundation, where we're thinking about our digital rights and what should they be? How do we look at the different huge legislative hurdles we had ahead of us and pick a strategy? Or how do we pick, a way to get off Facebook as a strategy? We're really, like, Valencia and I are part of the core project team, and like we're debating these things, like we're reading like all this legal theory. And for example, like I'm in this debate where we have this legal counsel who is an expert in what's called a civic trust or trust law. And trust law is interesting because it has a very different setup where you can basically have beneficiaries and trustees. And if we think about how we assign rights differently and have governance that is driven by patient communities, I'm still learning about this stuff. So I'm looking at trust law, I'm looking at evidence law, I'm looking at, with help from our legal counsel, contract law. There's so many different types of law. If you want to learn about that and really geek out, come with us. If that is too much, I would really invite you to just sign up and get updates on what we're learning. Reach out to us, tell us what your stories are. And then when we have specific calls to action beyond tweeting to be like light, we would love to really start organizing around, go here and, we're holding an event, or we're advocating for these types of policies, or, the White House right now has a civil rights digital rights bill that they're open for comment on, and we're thinking about submitting that before December. So, there are a lot of ways to get involved, and we're just trying to figure out an organizing mechanism for the support groups that represents their interests rather than the company's interests.
So we have to bring you back and we can talk about this again in a few months.
Wow, that we are at time.
I
would-
know, I told you it'd go by really fast. It goes by
It really
fast.
did. Oh my gosh.
Wow, it does. It does. But
It
so
goes
much
by so fast.
information
So
and,
much
and so much
information.
good information. You know what I mean? Like, it's not all just doom and gloom, but it's like there's an opportunity for you to get involved because this is uncharted territory. We're learning as we go, but we get to make the rules that work best for us. We get to advocate for ourselves. Same thing we talk about in breast cancer spaces. Advocacy takes so many different forms, and this is one of them. Even through your cancer journey, even as a survivor, as a thriver, as a metaviver, as a caretaker, or just as a consumer, like this is something where you may want to pay a little bit more attention in the future and put it on your radar. So it's definitely on mine because my mind was blown. I'm still looking up terms and trying to figure out, I still call it the Facebook and the LinkedIn and the Twitter. And, I told somebody once I needed to download the web. She's like, really? The whole web, the worldwide web? I was like, yeah, I got to download it on my phone. She's like, good luck with that. But for people watching, this is the age and the era that we're in, and there's no going around it. The only way through it is through it, but we get to do it together.
Together.
And figuring out how to make it work for you. Because we need this, if you want to use the space, know what you're up against and how do you make it
Right.
work for you
Right, right.
and what you need,
How to protect
Because
yourself.
you
That's right.
control it. Protect yourself, yeah. Whoa, thank you, Andrea. Thank you, my baby cousin Jilly.
Yes.
Thank you for having us. This is wonderful.
Yes,
Thank you guys. Thank
this
you
was
for
a
being
great
here.
time. I had so much fun.
Oh,
Thank you.
Sunday, we're on again.
Sunday, we're going to do our Halloween walk.
Halloween
So,
walk.
we will be walking. Join us at 3:00. Join us for our dance party on Friday. So Friday, we're going to be dancing at Moe's Farm.
Yay.
Wow.
So,
Should be pretty exciting. Yeah, we're looking forward to it.
yeah.
And then Sunday we'll see you, and then every Wednesday night. So we hope this has been relatable and reliable and real, right? That's what we set out to do every single Wednesday night. And we've been bringing it to you since COVID began, and we'll keep bringing it to you as long as blackdoctor.org allows us to be here to share these important topics with all of our breasties and their caregivers and our advocates and those of us in the
family.
breast cancer space.
Yep.
Yeah.
Thank you for being here. Thank you,
Thank you,
guys.
Valencia. So good to see you, Jillian. New family, Andrea.
We're going to the baseball game now
Yes.
and then a pink party.
Have fun. Go advocate for us. And guess what? The doctor's in.
Doctor's in. Breasty
Bye-bye.
love. Breasty love.
Oh, there it is. That breasty
Breasty
love.
love. Bye.
Take care.
Bye.
But